This month's Lunch and Learn with the National Bone Marrow Transplant Link will cover the latest on chronic GVHD, trials, research, and what's on the horizon. Our guests will be Dr. Farid Farr, a nationally recognized expert in the field. Additionally, survivor Steve Hodges will provide his best tips and tricks. This month's Lunch and Learn with the Link will be Wednesday, February 19th at noon Eastern. Sign up for free by visiting nbmtlink.org or just follow the link in our show notes. Welcome to Season 16 of Marrow Masters, sponsored by Sanofi. The National Bone Marrow Transplant Link, established in 1992, strives to help patients, caregivers, and families cope with the psychosocial challenges of bone marrow transplant, from diagnosis through survivorship. Season 16 of our show will focus on the best tips for dealing with chronic graft-versus-host disease. Top-notch healthcare professionals will share their compassion, best advice, insight, and caregiving tips regarding chronic GVHD. This season will offer education, tried-and-true solutions, stories of hope, and more. Now, here's your host, Executive Director of the NBMT Link, Peggy Burkhardt.
Hello, everyone. So today we have with us Jeannie Wiarda, LMSW Medical Social Worker at the Adult Blood and Bone Marrow Transplant Center at Corewell Health in Grand Rapids, Michigan. So Jeannie has a great deal of experience with chronic graft-versus-host disease patients and will share survivor strategies, helping us find hope and purpose. Today, we will focus on the very important social worker perspective. Welcome, Jeannie.
Thank you. I'm really excited to be here.
Let's dig right in, Jeannie. So can you share with us the details of your role as a social worker on the transplant floor at Corewell?
Absolutely. The social worker sees essentially every patient who is referred for possible transplant, and that would include allogeneic stem cell transplant, autologous stem cell transplant, CAR-T, and so on. Every patient interfaces with me as they're going through that pre-transplant process. Initially, I assess them in regards to their knowledge of transplant, their caregiver plan, their coping, their experience. I really like to understand, how do we get to this place? Because that's very specific to each patient and does affect how they walk through the transplant process and their relationship with their providers. I assess finances and barriers to transplant that way, as well as housing and substance use and other things that all play into that long recovery process of transplant. I take that information to what we would call our patient selection team, where we present our patients. And from there, my job is to take our patients who are recommended to move forward with transplant through removing barriers that could be, as I said, financial, that could be lodging needs, that could be psychological things like, for instance, if you have a veteran who had trauma during wartime and we're placing them in a hospital for 30 days or more, we know that that can be a huge challenge if there's PTSD involved or things like that. So how can I help that patient move through that process in a way that they can feel safe, that they can have access to the tools that they need to not only reduce infection risk and those things, but to cope with these underlying things that come in, because we're people and we live lives that are outside of this diagnosis. I see patients through their hospital stay, so it isn't just outpatient. So I follow them through the hospital stay. And then after we evaluate transitionally the first week post-transplant, and then the first 100 days and ongoing. And so then the role really kind of expands to as needed.
Okay.
Because things come up with patients, right? So it is definitely a long process, but I think the social work component in that is important.
So what would you say would be the average amount of time that you're with a patient, let's say from the beginning of transplant until, they go home?
I would say initially, prior to hospital stay, 1.5 to 2 hours of time, not including phone calls and emails and things like that. And then in the hospital, if you're on average there for 30 days, I probably would see you twice a week.
Okay.
Until you're discharged from the hospital.
Wow. So you really get to know people during their very vulnerable time.
Absolutely.
So Jeannie, let's talk about stress. You mentioned the PTSD. Let's talk about stress versus trauma, particularly the body and the brain connection.
one thing that I think has been really powerful in my work with patients is getting to know their stories. And what I find is, as I said before, people come in with past experiences, whether it be chronic pain, whether it be traumatic experiences like that bone marrow biopsy that had to be done very quickly without anesthesia, and the impact of that on the next bone marrow biopsy, right? Those type of things, as well as underlying depression, anxiety, past abuse that they may have experienced in their life. Those things all come into play when we're talking about going through the transplant process, and impact as well. I know we'll be getting into that later. Patients who do have GVHD as another layer of experience and another illness that affects their daily life. So if you take things like stress, our brain is an amazing thing. When a stressful event happens or something is stressful to us, the brain reacts to that. And it does a great job of that. It releases hormones that help us be alert and ready. It activates our nervous system to be in what they would call that fight or flight. Mm-hmm. Typically, on a normal day, what we would see is that when that perceived threat is done, our brains can get rid of that cortisol and just go back into stasis, where we can effectively function the way we would do on a daily basis. Now, that changes when you have compounded traumatic events, or you're in a place where that feeling of fight or flight or that perceived threat doesn't ever come down to kind of your normal stasis. And that's where things can really be affected. Specifically, our brain being in that chronic stress mode or releasing all of that cortisol and operating in that fight or flight status, it affects how we function emotionally, physically, just in daily life. It disrupts our ability to process information, to remember things. It changes our ability to want and have connections with people. It literally can shrink parts of our brain and cause damage to parts of our brain. It changes our ability to regulate our emotions. So it can very specifically impact how patients move through not only the transplant process, but if there are complicated medical challenges related to transplant, as well as moving into GVHD, whether it be acute or chronic.
This makes me think of when you said, the ability to process, boy, that caregiver really comes in handy as another set of ears. Let's talk for a minute about the caregiver and really how extra important that is during this stressful time for a patient to have that great caregiver.
Absolutely. So for us, a caregiver is essential. I don't think patients can go through this without a caregiver. And I think you're right in that initially, to be able to have an extra set of ears to gather information, to advocate for somebody, all of those things is super important. But also, we know when you are recovering from transplant, whether you're in the hospital or you're at home, whether you're living with GVHD, having somebody to remember medication changes, having someone to drive you back and forth to appointments, having someone to advocate for you by getting on the phone with your medical team when you have a fever, or they just know you and they know that you are not who you really normally are.
Sure.
Whether that be a cough, whether that be a loss of interest in doing things, that emotional piece of this, we're just not drinking enough water, or I just noticed he's not eating enough. It is really hard for patients to step outside of what they're going through to recognize those things. And so it is life-saving and life-giving to have a caregiver.
And let's talk about the self-care that needs to happen for these long-term caregivers, because we know with GVHD, it's going to be a long haul sometimes.
Yes. So, we talked about chronic stress and PTSD, trauma in the brain. And I think if we're going to be affected by anything going through something like this, transplant, and especially living with GVHD, we really need to come alongside our patients to find ways to allow their brains to heal. And there are tools to do that, to allow for patients to have support and the ability to have some autonomy, we can really lose a lot. GVHD causes so much loss in our patients.
Mm-hmm.
I also think financially, there's so much loss in this. And just the ability to feel like you are a person in your own body, that ability to feel like I am who I am, I think can get lost. And so finding ways to help patients to remember and know who they are at their core and still live, even though that may be different or modified because of the disease and where it affects the body, is very important in recovering and moving through life if GVHD is going to be part of your life. Sometimes we don't know how long. Sometimes it's a lifetime. Sometimes it's months, but we don't know.
So, Jeannie, you had mentioned to me the importance of education, practice, and connection. I really want to hear more about this.
Yeah, so education, obviously, there's so much out there that we can learn. We have so many amazing resources, and being connected to organizations like BMT, Infonet, the National BMT Link, the NMDP, LLS, or Leukemia Lymphoma Society, and the GVHD Alliance are huge sources for education for our patients and families. You can find the information, the cutting edge, the things that are strategies and tips to moving through that latest GVHD attack or that thing that is very difficult right now, those itchy eyes in your skin, right? Those things, you can find so many resources by just immersing yourself in that education. Sometimes patients are able to do some of that, but I definitely feel like caregivers really take on a lot of that responsibility. But it does create the ability to effectively advocate for yourself. And I think a sense of control, because you can say, listen, I read this and it said that this particular cream or this person that I met on this Facebook support group said that they went to this specialist, right? The things that we don't know until we look and we ask the questions, right? So I think having the freedom to do that through education and then asking the questions of your providers is powerful. So that's the first part as far as education.
Jeannie, let's talk about finding hope and purpose for our survivors as they're getting home and getting acclimated and the GVHD is maybe starting or the fatigue is setting in. Tell us about this.
Yeah, so I really like to concentrate on a few important pieces to this. The first, as we talked about, is education, and that's ongoing. The second is maintaining or working through a healthy lifestyle. So your diet, how much sleep you're getting, and stress management are so important in fighting this battle through GVHD. And I know that is sometimes hour to hour, sometimes day to day. And so those pieces really give us the strength and the ability to fight this physically. The next for me would be strong connections to people or our supports.
Mm-hmm.
I know this is a struggle if you have to be isolated. And so the caregiver is an important piece of that. And I would also recognize that it is so important for the caregiver to have their own outside supports. I always like to say, preemptively, let's schedule you days when we're through this hospital or we are moving down that road in the ups and downs of living with GVHD. Tell me, what days are you going to go have coffee with your friend and accessing that secondary caregiver or that friend that can come and be with your loved one, with that patient? Not reactive, not, oh, I can't take it anymore and I just need to get out. But let's just plan.
I like that.
Because you're going to be a better caregiver. You know, I think they say that to moms or dads all the time. You're a better parent if you can practice good self-care. And I know that's easier said than done. But I think if we think about it in a way of, I have to refuel so that I can take care of that person, because it doesn't just impact the patient. And I think the relationship with that patient is altered as you're on this very long journey through GVHD. If you're looking at this is your partner, your spouse, this affects your intimacy. It affects the dynamics of your relationship as a whole. where first you were equal partners and now being the caregiver, it really does change that dynamic when that person is reliant on you for everything. And so to find ways to not only refuel, but then find ways to connect in a way that feels equal. Sometimes that's allowing the patient to have some autonomy in certain things. But also, I think that moves us into finding ways to live. And so how do we find who we are and remember who we are at the core? I listened to one of your GVHD podcasts where a gentleman was talking about how he had an e-bike and he had realized through his GVHD journey that he wasn't going to be riding 15, 20 miles on that bike. But his passion was still getting out into nature and riding. And so that e-bike was a perfect adjustment for him to be able to still take a core value of his, but then know the limitations of what his body was able to do at that time and safely be able to take care of himself. So finding those little ways to live are so important. I had a patient once who, she said, "What do you think about a couch to 5K?" And I thought, I mean, ask the doctor, but for her, physical activity was part of her ability to gain control of living because, I think she talked a lot about just feel like everything in my life revolves around going to these appointments and coming back, and there's no real purpose in that. So if you can find a way to remember the things that you loved that made you who you were, whether it be something creative, art, music, being outdoors, find ways to create a new way to do those things, right? Like the e-bike or a couch to 5K, maybe not a marathon, but we're doing it, right? So I think it's powerful and it gives us purpose. Why am I doing this? You're doing this because you want to live. You want to be a person in this world again.
Yeah.
For some people, it is about family. So their goal is, I really want to go to this birthday party or to experience this trip. For instance, there was a newly married couple and they were going to do the Route 66, right? The Route 66 all the way. And there was just no way that was going to be too long of a trip in their journey. But we talked about, what about a trip 2 hours away? We're still taking a road trip together. So again, remembering at the core who you are and trying to find ways to still live life in the middle of all of this is powerful. And I think you gain part of yourself back. So strong connections to people, your support's very important. I think also that can be even more powerful when we are able to find others who are going through similar things. So, there is a large Facebook GVHD support group. I think it's, over 4,000 people, if you can imagine that. And so it's not for everyone, but I think there is power in connecting with others who may be going through or have gone through similar things. It helps you feel a sense of not being alone. And I think that can be an important piece. And then the third piece of connection for me would be sometimes people find volunteering or doing some works of service as a powerful tool in regaining their life. I think it gives us a sense of gratitude and accomplishment and purpose when we can do something that we know is positively affecting other people. And that might not be that you're going out and passing out flyers or speaking to a large 1,000 group of people. It could be the person who comes to mind who is knitting hats for all the patients that come in and have lost their hair, or writing notes and then just sending them so that they can say happy birthday to that person, or good job, this is your 1-year anniversary and look where you are now. And those things, again, are ways that we can find purpose in daily living.
Oh, I love that, Jeannie. I spoke to a survivor the other day that kind of goes along with what you're saying. She said, I didn't work this hard to stay alive, to not enjoy the rest of my life.
Yes.
And I think everything you're saying just really complements that idea. Boy, your patients are so lucky to have someone like you. You can just feel how much you care about them. And I'm sure that makes such a difference in their survivorship. So thank you for what you do.
Thank you.
You had mentioned books that you would recommend. I'm an avid reader, so of course this just gets me all excited. Would you want to share some book ideas with us?
So as we talked about earlier, I'm a big fan of how does our body, our mind, our brain, how is that all connected and how do we cope through life things? I think it's very powerful and it can only help us to heal. And so one book that I really enjoyed reading was The Body Keeps the Score by Bessel van der Kolk. It is a very profound book, and I think it just gives you an idea of, like I said, how our brain and our body work together and the effects of trauma and how to heal. There are a lot of good things in there. They do focus a lot on physical trauma and abuse and things like that through, but I think the research that they did is very profound, and I think the tools that can be gleaned from that specifically would be practical things like yoga and meditation and mindfulness, having hope in that even though we go through trauma, our brain can create new pathways to cope. And it's not that we have this thing that happened to us and we are permanently unable to function in life. I think our brains are amazing and we can come through and regain who we are, although changed, but for the better, to do life. And so that's a book that I really love. On a GVHD transplant topic, I would say journaling or having the ability to sit down and reflect, whether it be writing it down or speaking through your thoughts with somebody else. The Leukemia Lymphoma Society has a publication called Each New Day, Ideas for Coping with Blood Cancer. And the information in it is wonderful, but my favorite part about it is at the end of the book, it has just questions and prompts that just allow people to say, okay, what questions do I have after that appointment? How am I feeling today? What am I feeling in my skin and my body? Are my muscles tense? How can I speak to those things when I go and talk with my doctor? I think sometimes what I see, and I joke with patients in the hospital about this, but everybody rolls in there in rounds and there's like 15 people in the room, right? and the doctor's like, do you have any questions? And of course, patients are like, nope, no questions. And I usually hang back and wait till they all leave. And then I say, okay, that was a lot of information. How are you feeling right now? Or what thoughts do you have in this moment? The power to process just in the moment, whatever's going through your head, or to have the time to just sit with your thoughts and then express, oh yeah, I should have asked that question, is really, really important. And sometimes we don't give enough space in the medical community to be able to do that. So a book like that can be helpful because it does prompt you and then allows you to write down some of that so that you can advocate for yourself.
Oh, I love knowing about that. Thank you so much. And by the way, we will make sure that all of the books discussed, any sort of resources like that, are listed in the show notes. So thank you so much.
In practice, as far as therapy, I would recommend patients finding a therapist that has some connection with or understands what the transplant process is. I know that there are, again, resources on different sites that have sources of here's all the providers in your area that may be able to speak to this. So cognitive behavioral therapy can be very helpful in processing negative thought patterns and the effect of that on your behaviors and teaching your brain how to reframe thoughts and then change behaviors. For example, if you are practicing avoidance, right, because of the trauma that you're going through with GVHD, and so your body is saying, no, 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 you don't want to make that phone call. No, no, no. Maybe we can just push that doctor's appointment out for another week. Being able to work through some of that, which is a normal and natural thing for our brain and our body to do because of the trauma patients have experienced, cognitive behavioral therapy can be really helpful. On the other hand, some patients also find that EMDR, or eye movement desensitization and reprocessing, is another form of therapy that can be very helpful. And essentially what we're doing there is it's a way to process trauma experiences or what you're going through your transplant process and living through GVHD to reduce those symptoms or that emotional charge that comes with that next bone marrow biopsy, or when you go to the doctor, you're so triggered and you feel really anxious, or that test that you're waiting for. And so that just activates all of those thoughts, feelings in your body and in your brain. That's all trauma. And so EMDR can be a good way to work through those experiences so you can reduce that reactivation. So it's not so much living in your body and in your brain like you're reliving it every single time. It can be very powerful.
Is EMDR something that most therapists know about and can initiate with a patient, or is it a specific thing that you go to a specialist for?
So I would say all therapists, social workers, psychologists would know about it. Not all of them are certified in it, but I would say should be easy to find out those who are certified in EMDR in your area.
Jeannie, you mentioned helpful directories with mental health therapists, and I just wanted to give a shout out to BMT InfoNet. They have a fabulous site where they list state by state the therapists that handle that. And I know that's what you were talking about.
Yes.
So as we wrap things up here, biggest concern, most common theme as you're letting people go home, what is their biggest concern and how do you address it?
I think with GVHD, the biggest concern is finding purpose in day-to-day, moving through the loss and the grief of this ongoing and changing thing called GVHD. The fear of dying is another one.
Mm-hmm.
And so I think those things are powerful things that kind of ebb and flow. And so finding purpose and finding ways to live life is key. Second, have compassion. Have compassion for yourself because this is hard and it's okay if we have a bad day.
Mm-hmm.
And allow yourself to feel what you feel and find safe places, whether it be therapy, whether it be through mindfulness, whether it be through your supports, to express your thoughts and feelings without judgment, without fear. It's very powerful to be able to work through whatever those thoughts and feelings are is huge. And then I think lastly, obviously the financial implications of living with GVHD, cost of the treatments that patients go through, the travel that some patients have to go through just to access specialists is overwhelming.
Mm-hmm.
So I think those are the things that really are key and we should be supporting our patients through on an ongoing basis.
Somehow I have a feeling you're doing just that, Jeannie. Thank you so very much for this incredible perspective. There were things here today that just A+. Really, you hit on so many things that we haven't hit on before, and I really appreciate your knowledge and your compassion. Thank you so much.
Thank you, Peggy. I feel that it's a privilege to be able to work with patients and families, and I'm humbled every day by the fight that our patients go through and the things that they teach us. We can be only as good as the compassion that we're able to show people and the ability to stand and hold place with them and allow them to be who they are. I just appreciate you allowing me to come on here and speak with you and spend some time talking about the important things.
Thank you so much.
This has been the Marrow Masters podcast. If you know someone who would benefit from the information in our show, please share this episode with them. And don't miss future episodes of our show. Follow Marrow Masters for free on Apple Podcasts, Spotify, YouTube, or wherever you're listening right now. And to connect with the National Bone Marrow Transplant Link, visit nbmtlink.org or tap the link in our show notes.